Hey guys, just a real quick video. This is going to be an IND of perirectal abscess. It says on the preference card that it is supine, which is kind of weird because we're going to go to the perirectal area and it's going to be hard to get to it if it's in supine. So I'm not really sure what the position is going to be, but this is what I have. And I'm not very familiar with the surgeon's preference, but I just kind of got the things that I know based on my experience. And of course, you need blade, you need DeBakey's, you need meds. I always put hemostat, some Babcock, Coker, and some Alice's. And of course, some retraction and some laps. And here I have the surgeon's gown. He's 2XL. And then this is mine. This is a minor drape procedure. It's just literally a square. So usually we use this on a perirectal case where the patient is on prone position. But like I said, this is gonna be supine, so I'm not really sure how they're gonna do this. So I have 4 towels that came with the pack, extra towels. This is my minor procedure tray, and I just categorize them as small DeBakey's, forceps with no teeth, and then this is, I believe, a Bonnie's. So the way our SPD organized their stuff is pretty visible to me, so I try not to mess with it as much, so I just put them that way, and that's kind of like your preference. And this is my stringer right here. And always, all the time, I always have my scissor and my needle driver that I'm gonna use, so it's easier to just pick up. And then I just have my syringe here and a 25 gauge needle. And like everything, you have to label all your liquids. I haven't put it yet. My nurse is gonna put it in for me. And then I just have some Raytex that came with the pack and 5 laps. And this basin right here, this is usually where they put the water to wash off the instruments, because we both know that when you wash instruments in saline, it corrodes the metal. So we try to use water. But beforehand, I just stash all my things here that needs to be thrown off the field, and that includes the Bovi that's in there, and my suction, and my Yankauer is up there, and the light handle covers. And usually when you're like really busy and you have a lot of cords to throw off, I would usually set these up to my Mayo so that the surgeon could grab it himself and help me put it on. The more hands, the more better. The more better, not a word, but it just helps to expedite the process. And I like it when the surgeon just doesn't stand there, so I give him something to do so he's not like impatient. So this is what I have. Hopefully it doesn't escalate, but if it does, then I'm prepared for it. We have a major tray for that on standby. So yeah, this is what I have.